Sounds good. Good afternoon, everyone. Happy Monday. Thank you for joining us for the Policy Platform in Action, how to use the platform through community engagement. Thanks for joining us for this lunch and learn. I hope you got some good food to eat, and it's our hopes that you take away some short bites of useful tools and tactics as we go along. My name is Yolande Burris. My pronouns are she, her, hers, and I'm the program manager for AMPLIFY, the African American Statewide Coordinating Center. And I'll be presenting and moderating alongside Julie Amajoy, lead staff attorney and national technical assistance provider with the Public Health Law Center, along with Shristi Reddy, associate specialist of the Loop. The second portion of our time together includes a fantastic group of panelists from community-based organizations to faith-based organizations that we partnered with throughout the last couple of years. They've done a fantastic work in the community and implemented the policy platform in the work that they do, which we so desperately need. So on behalf of all of us, I welcome you to our space. As we move along, Shristi will be moderating our chat as well as our questions for you. And I know she's going to begin an icebreaker at this time. So please introduce yourselves. We'd love to know where you're from. We'll take a look at our agenda for our time together. And I'll begin with a brief overview of our policy platform agenda, followed by a presentation from Public Health Law Center. Shristi will then facilitate our questions. So please feel free to add questions into the question box, and we'll also have time for open microphone so you can ask your questions in another form if it's more elaborate. And I'll then introduce our diverse and amazing panelists, and we'll dive into our discussion. And we'll end our time together with audience questions for our panelists. So I hope that sounds good for you all. A few reminders, this webinar is being recorded. And please feel free to ask questions in the question and chat box. And there will also be opportunity for you to ask questions unmuted. And please do not forget to fill out our survey. Also, make sure that you're able to download our African American Policy Platform fact sheet. It will be added to the chat, and it'll also be found on our website at amplify.love. Learning objectives. We are hoping that you gain a clear understanding of the policy platform's utilizations for community engagement within California. We'll provide shared examples of utilizing the policy platform within the current community work that's being done in our state and communities, and also connecting with other organizations working with similar priority populations. So a bit about AMPLIFY. We are the African American Statewide Coordinating Center. We are one of 6 coordinating centers that focus on the priority populations within our state. We were established in 2018 through the California Tobacco Control Program, and we're funded through Proposition 56, the cigarette tax initiative. We provide technical support to community-based organizations throughout the state, and we assist them with the work within their communities to eliminate the burden of tobacco. We incorporate social justice and issues surrounding tobacco as it relates to the Black and African communities. We also incorporate policy work. We meet with our elected officials to move policy forward. We also train and do technical assistance advisory to those community-based organizations so that they can do the work with their local elected officials as well as their community. So we realize that enough is enough, and we're here to amplify all of the voices within our communities. So we love Black smokers. We're amplify.love, and we want to see everyone live a life that's free from addiction and nicotine. And we understand that they've been targeted by an industry that profits off of death and destruction. So we work towards the end game. And for this reason, we provide community engagement, technical assistance to traditional and non-traditional community-based organizations. It's our mission to work collectively in love and unity and cultural humility to educate, empower, and engage the communities to end commercial tobacco use. I briefly want to touch upon some of the multi-tiered issues that face our community and affect the health and wellness of our people and drive smoking behaviors. So it's important that we realize the cross-sectionality within the stressors that have impacted the community. We have run the gamut from everything from LGBTQ rights to school to prison pipelines, recidivism rates, Black maternal infant health, COVID-19 becoming an emerging issue in our community, low social economic status, Black mental health and wellness, and newly, the yes vote on Proposition 31. Where do we go from here? And what is that going to look like in our community? And also the education surrounding it. So we have a lot of different issues that can all be correlated and corresponding with tobacco use. And so within our policy platform, we do hope to address some of these issues and really get down to how we can heal our community. I'm sure that many of you are already aware of our tobacco policy platform, but I'll briefly go through some of our tenets, actually all of our tenets, and I encourage you to download our fact sheet for you to learn more. And if you have questions about the policy platform, I'm happy to answer them for you. I'll make my email address available for you as well. Our platform was developed alongside the African American Tobacco Control Leadership Council, the AATCLC. This has been a longstanding policy platform that was created, and these are the tenets that we believe in. The AATCLC is our sister organization, and they focus on policy and advocacy work nationally. So we were able to take these policy platform issues and actually direct it to what is happening in our communities within California. And our number one platform objective was to prohibit the sale of all flavored and tobacco products, including menthol products. And thanks to the tireless effort of tobacco control advocates throughout the state and nationally, we're closer to seeing this come into fruition. However, this does not stop us from supporting the work locally in our jurisdictions to make sure that we protect the rights of those who are underserved. So we want to make sure that we have local ordinances in place that can supersede state legislation should it be halted and hindered. For example, I have here an ad that was recently released from RJ Reynolds, the crisp no menthol cigarettes. This is their rebuttal to Proposition 31 yes vote. And so we always have to be on the lookout of different methods and strategies that are used by the industry to keep this health and wellness hindered in our communities. Protecting our children by making tobacco use and the predatory marketing of flavored tobacco products one of our top 5 priorities facing our community. So according to the CDC, tobacco product use is targeted and established primarily during adolescence. We have nearly 5 out of 10 adults smoking cigarettes daily. They first try smoking by the age of 18, and 99% first try smoking by the age of 26. So we have a lot of work here. Amplify creates and promotes productivity through spoken word, coloring books, and also helping engaging our community through social media content. It's very important that we think of out-of-the-box strategies and strategies that are already being used by the industry to target our community and educate them. Working within our organizations and religious institutions to mount a sustained and comprehensive campaign against the tobacco industry. We advocate for the adoption of non-acceptance of tobacco industry sponsorships, contributions, and policies. This is some of the national work that the AATCLC has done through the through different organizations such as the NAACP, as well as our Divine Nine organizations. We've had great leverage in that realm and avenue. On the smaller side with the state of California, AMPLIFY has led the Faith Leadership Development Program and built the agency of 10 to 15 faith leaders that organize and mobilize the communities and congregations for health, empowerment, and wellness. And you'll hear from some of those organizations today. Understanding the predatory marketing and tobacco use perpetuates poverty in our communities. So as we know, this is something that is prevalent in that we have to consistently educate our communities about, but doing it the right way with a specific strategy that is targeted toward the African American community is something that we can continue to develop and create leverage on. So a 2019 study of the BMC Public Health found that socioeconomic status is a major determinant of tobacco use. And lower socioeconomic status promotes smoking more frequently at higher levels of dependence and smoking exposure. Holding the tobacco industry responsible for the irreparable harm that has been done to our community. The AATCLC is working on a national level to make sure that we have the services we need to combat the disease and the harm that has been implemented in the communities. We're looking at positive ways to combat cessation efforts in ways that actually are effective in our communities. We are working on websites. We're working on different projects that are leading to health and wellness. An example of this is a SPA 6 project that we're working on with our cessation expert, Dr. Karen Beard. And this project is actually training the community-based organizations to become tobacco specialists and heal the community. So I'm really excited to be introducing that and just promoting it. If you are interested in learning more, please feel free to reach out to me. Working with elected officials to develop a comprehensive tobacco control platform that will eventually reduce tobacco-related illness and improve health equity in the African American community. We formed excellent relationships with the California Black Caucus. We meet with these members to ensure that the health of our people is a top priority. Demanding adequate funding for tobacco prevention programs, such as cessation, and culturally appropriate services to help stop smoking. And I mentioned this a bit. Supporting raising the pricing of all tobacco products, especially the cheap, unregulated tobacco products that inundate the African American community. We support and demand smoke-free multi-unit housing and other protections against secondhand and smoke exposure. And lastly, we advocate for policies that explicitly exclude civil or criminal penalties for use and possession of tobacco products. And we look forward to having a deeper discussion about this topic alongside the AATCLC in a later webinar. This narrative continues to be pushed and it must be counteracted by community-based education methods. So let's work together to dispel this myth. And at this time, I would like to introduce the Public Health Law Center's Senior Staff Attorney and National Technical Assistance Provider, Julie Amajoye. She'll discuss our policy platform further. And we do welcome questions and we'll answer them at the end of Julie's presentation. Julie?
Thanks, Elon. I'm going to share my screen now. Can you see my screen? So hi, everyone. I'm Julie Amajoye. It's great to be with you all today. And I want to thank Elon and Amplify for inviting me to present today. And I thank you all for joining this session. Before I launch into the presentation for today, and I'm going to be focusing on updates on California's flavor ban and what that means for California local communities, as well as local policy best practices. I want to say a few words, though, about the Public Health Law Center for those of you who may not be familiar with us. So we are the Law and Policy Partnership to End Commercial Tobacco Epidemic. So the Law and Policy Partnership to End the Commercial Tobacco Epidemic is a joint initiative of the American Lung Association and the Public Health Law Center to support tobacco control professionals in their work to end commercial tobacco epidemic in California. So the partnership provides free technical assistance, research, training, and analysis to help communities pass strong local tobacco ordinances that are both effective and legally sound. So a little bit more about the Public Health Law Center. We are based in St. Paul, Minnesota, and we want to give credit to the native homelands of the Dakota people. Where we sit, we collaborate with others to reduce and eliminate commercial tobacco. We promote healthy food, support physical activity, and address other causes of chronic disease. Our partnerships include tribal health leaders, federal agencies, state and local governments, national and regional public health advocacy organizations, community coalitions, and others like all of you who are working to advance public health policies. So we provide many types of legal technical assistance, including evidence-based legal research. We help communities to develop sample policy language on a variety of tobacco control policies like flavor tobacco policies. We offer guidance on implementation and enforcement issues. We also support communities in defending policies that come under attack. So when the tobacco industry, challenges, local policies or, any of these policies, communities can reach out to us for help in defending these policies. We also develop many publications, which we post on our website, and we offer trainings and webinars on important tobacco control issues. What we don't do, however, we don't lobby and we don't provide direct legal representation. So I also want to emphasize that at the core of our work is a commitment to equity and health equity for all people. And when we develop model policies and when we help communities with policies, we are always doing that with an eye on the health consequences and the equity consequences of the policies we draft. So in this, the agenda for my talk today, I'm going to talk about, the California flavor ban legislation and what that means. Some of this you may already know, so bear with me. I'm also going to talk about the public health impact of flavor regulation. I think Yulan has already talked a little bit about some of that. I'm going to talk a little bit about the federal action on flavors so far, and local flavor action and best policy practices. And some of this is going to be pretty high level. I only have 15 minutes for this presentation. And I can always take any questions you may have at the end. So Prop 31 passed. Wonderful news. This is huge for health equity and for addressing tobacco-related health disparities. So what does this mean? So this law that now has approved SB 793, which prohibited the sale of flavored tobacco in August of 2020, will become effective latest December 21. So the law takes effect the 5th day after the Secretary of State certifies the election results, and the Secretary must certify the results by December 16. So the latest day for this to become effective is December 21. So once the law takes effect, so what does this law prohibit? So it prohibits the sale of menthol cigarettes. These are the flavored products that it prohibit: menthol cigarettes, flavored chewing tobacco, snuff, little cigars, e-cigarettes, and roll your own tobacco. It does exempt certain products though. It exempts flavored hookah and shisha. It exempts flavored pipe tobacco, and it exempts flavored premium cigars. So once the law becomes effective, tobacco retailers will no longer be allowed to sell products prohibited under SB 793, and they'll be required to remove all inventory, all of the products covered under this law from their shelves. The penalty for retailer violation, and I want to emphasize that this law only penalizes retailers. It doesn't go after it doesn't go after individuals who use or purchase these products, only retailers. And the penalty for retailer violation is $250 per violation. So very importantly, though, this law doesn't preempt local communities in California from doing more in terms of sales restrictions, as well as including restrictions on flavored tobacco products. Now, I want to note, and some of you may already be aware of this, that the tobacco industry has already filed suit one day after Prop 31. The next day after the law passed, they filed suit to challenge the law. So so this was November 9th. So this law is going to be very impactful for public health, and all of you on this call already know, the reasons why. Menthol, as you know, is disproportionately used by particular communities, including racial and ethnic minorities, the Black community, LGBTQ smokers, and youth. 7 out of 10 African American youth who smoke use menthol cigarettes. And menthol cigarettes is one of the major reasons why tobacco use is a leading cause of preventable death among Black Americans. And we also know that the tobacco industry historically has targeted particular groups: Black, LGBTQ, young women, low socioeconomic youth. Historically, these groups have particularly been targeted with menthol cigarettes. And we also know that retailers, and Yulon said, mentioned, the correlation between, tobacco use and socioeconomic status. We know that retailers tend to congregate in lower income areas. So in these areas, we see a higher density of tobacco retailers, cigarettes are cheaper, and there is more price discounting and promotions that tend to be offered. Studies have also shown that there is more menthol advertising near high schools with more Black students. And in California, for every 10% increase in the proportion of Black students, there's a 6% increase in menthol advertising. And the odds of a Newport promotion were 50% higher. And the cost of a Newport was 12 cents lower. So, so we know that, this is going to have a significant impact on youth use of tobacco, because as we know, flavored products are highly appealing to young people. Menthol, over 80% of youth initiate with the use of flavored tobacco products. And we know that flavored products, particularly menthol, increases initiation, and it decreases cessation, and it exacerbates health disparities. So just to say a little bit about what the FDA has done so far. So we've talked a little bit about California. So what has been done so far at the federal level? So this year, we've seen significant action around flavors at the federal level. I'm just going to highlight some. So in 2020, the FDA took limited action that was specific to e-cigarettes, flavors in e-cigarettes. So they prohibited certain sales of flavored e-cigarettes, but this did not include menthol. And it applied only to cartridges or pods, and it excluded all flavor. It also did not apply to flavored cigars. So that was in January of 2020. So this year, in March 16, 2022, the Congress amended the tobacco product definition under the Tobacco Control Act to bring synthetic nicotine products under FDA regulation. Why is this significant? Well, with the 2020 action on e-cigarettes, what happened was because disposables were still permitted, many companies switched to disposables, and disposables became popular. So currently, Puff Bar, which tends to, come in, which is mostly disposables, is has surpassed Juul, is the current most popular brand among youth. And what happened is that Puff Bar, companies like Puff Bar switched to synthetic nicotine products, which comes in a variety of flavors to continue to attract kids. So until the FDA made this action in the federal government, modified the Tobacco Control Act in 2022, synthetic nicotine products was outside of FDA regulation. So with that change, because before the tobacco product definition applied only to tobacco-derived nicotine, so only FDA could only regulate tobacco-derived nicotine. So now they can regulate nicotine from any source. So now they can regulate synthetic nicotine products. So which has public health impact, and companies like Puff Bar or products that have synthetic nicotine products now have to get approval from the FDA to market their products. So also, as you all know, in April 28, the FDA announced proposed rules to prohibit menthol in cigarettes and flavors in cigars. And in June of 2022, the FDA denied authorization to Juul to market its products. That order is currently stayed. Juul sued, and that order is currently stayed. So just to say a little bit more about the menthol and the menthol rules. So the FDA action around menthol has been a decade in the making, and the AATCLC, Center for Black Health and Equity, and the Public Health Law Center have been highly instrumental in getting the FDA to act. In 2013, about 9 years ago, the Public Health Law Center filed a citizen petition calling the FDA to ban menthol in cigarettes. But it took the FDA 9 years and a lawsuit filed by the AATCLC, for the FDA to act. So the proposed menthol rule prohibits menthol as a characterizing flavor in cigarettes. As part of our comments, we note some potential weaknesses with the rule. I mean, the rule is going to have huge impact for public health, when the final rules come out. But there are some potential weaknesses with the proposed rule. It does not address menthol as an additive. So menthol is prohibited as a characterizing flavor. What that means is that menthol could still be in the product, but it wouldn't rise to the level of, so it could still be in the product as an additive, but it wouldn't rise to the level of a characterizing flavor. And ideally, we would prohibit menthol even as an additive, because even as an additive, it still has is not as effective as it could potentially be if menthol was completely removed as an additive. Also, the proposed rule doesn't define characterizing flavor, and this could present some enforcement issues potentially in the future. And we also have similar concerns or similar weaknesses with the flavor cigar rule, which would prohibit menthol as a characterizing flavor in cigars. So the rule was published on May 4th, and then there was a public comment period that ended on August 2nd. So currently, the comments are being reviewed by the FDA. And the next step is for the FDA to publish a final rule. And the timeline for this is entirely up to the FDA. So typically when once the final rule is published, there will be about a year from publication before the rule becomes effective, a year after publication before the rule becomes effective. And of course, the industry is likely going to challenge any final rule. So the upshot of all of this is that, as far as the federal rules are concerned, we are looking at a fairly lengthy timeline. So local states and local communities should still continue to work to advance flavor tobacco bans and not wait for the FDA. So, as you probably all know, states cannot set tobacco product standards. Only the FDA can set tobacco product standards. So So things like ingredients in the products, the constituents of the products. Only the FDA has authority to do that, but states have the authority under the Tobacco Control Act to place restrictions on sales, including sales of some types of products, such as flavored products. And states and localities have been active in passing flavor bans. Some of the most active states include California, Massachusetts, Minnesota. In fact, California is perhaps one of the most active states, with 139 localities in California that have passed some kind of flavor ban. And the majority of these bans include the ban on menthol cigarettes. So some best practices as local communities continue to work to pass flavor bans at the local level, even with the California, with the state ban, which is, it's California becomes, the second state with the most comprehensive, comprehensive policy around flavors. But as I mentioned, there are still some gaps. Hookah is exempted, pipe tobacco is exempted, premium cigars are exempted. So there is still much room for localities to close some of these gaps and to have even more comprehensive policies. So what a comprehensive policy would look like include, it would be a jurisdiction-wide ban, so to cover the entire, apply to the entire community, the entire jurisdiction. Menthol flavors would be prohibited. It will include all tobacco products with no exemptions for particular products like hookah or cigars or anything like that. And it would also, it will not include any retailer exemptions. So we see policies that exempt tobacco bars, or they exempt adult-only shops or retail tobacco stores. So a comprehensive policy will include all retailers, regardless of the type. And so we also, encourage communities to have a strong comprehensive definition of flavored tobacco product. So our model defines this as any product that imparts a taste or smell other than the taste or smell of tobacco. So the only flavor that is exempted is tobacco flavor. So all other flavors are, every other flavor, menthol, mint, candy, fruit, chocolate, all of that is covered, and that is distinguishable by an ordinary consumer. And the reason we sort of emphasize that it has to be distinguishable by an ordinary consumer is that we've seen challenges in some states where, with regards to enforcing a flavor ban, where the issue is, how do you determine that a product is flavored? So that language makes it clear that you don't need an expert to determine that something is flavored. So it's what the ordinary person using the product can discern. And one of the something else, that we've sort of seen with flavor products too is, some products, once communities began to prohibit flavored products, you have the tobacco industry coming up with so-called concept flavors. So these are products that they're not explicitly labeled as being flavored, but they use terms like blue or jazz or purple, and that is to sort of hint that they are flavored, but it's not clear that they are flavored. So it's a way to circumvent the whole the flavor ban. So that raises enforcement issues for some communities in terms of what products are flavored. And so this language again also makes it clear that this doesn't depend on the labeling of the package or anything, but the smell, what the ordinary person can discern. So, some communities, as I mentioned, in California have adopted very comprehensive flavors, like we have here trophy cities. So these are not the only communities that have, these are just examples of some communities that have passed comprehensive bans. There are many other jurisdictions in California that have all of these, that have met all of these best practices, but some of them include Oakland, Sacramento, San Francisco, and in California. So another important thing to mention here is the need for strong enforcement to make sure the policy is effective, because a weak enforcement diminishes the strength of the policy itself. So with respect to enforcement, one of the things, Yilon mentioned this as part of the policy platform is, we discourage, discouraging on and eliminating, what we call PUP penalties, purchase, use, and possession penalties. So we know that, the tobacco industry has, targeted particular groups. We know that nicotine is highly addictive. So for all of these reasons, and the fact that it's easier to enforce against retailers, we encourage communities to focus policies and to focus enforcement on retailers. It's not the best use of resources to go after individuals, and there are also equity issues with PUP enforcement, equity issues with purchase, use, and possession enforcement. So it's much easier to target the retail side with compliance checks. So another important component of achieving compliance is retail education. So, making sure that, retailers are aware of the, the new restrictions, and that there's, substantial retailer education before and after the policy is passed. And of course, compliance checks are critical for enforcement. They have been shown to be effective at reducing the sale of flavored products. And we recommend several compliance checks per store per year, with at least one of them using a youth decoy. So I just want to highlight some of the resources we have on our website. So we have a comprehensive tobacco retailer licensing policy that includes, a flavor ban restriction, including language for prohibiting the sales of flavored tobacco products. And as I mentioned, communities in California that are interested in, going beyond state law with respect to, flavor bans or, adopting any of these policies, can reach out to us, for assistance. We also have policies, that talk about, that just give general education around regulating flavored tobacco products. And we also have a publication, U.S. sales restrictions on flavored tobacco products, that highlights, various communities, including various communities in California that have passed, these types of policies, and some of the highlights, key points of their policies. We also have a policy titled Keeping Hookah Tobacco in Flavored Tobacco Sales Restrictions. So this goes, this sort of talks about why it's important not to exempt hookah. As I mentioned earlier before, exemptions make policy enforcement, any exemptions make policy enforcement more challenging. They make litigation trickier, and as you all know, they are not as effective. They don't have the same public health impact as a comprehensive policy, so they diminish the public health impact of the policy. So we also have another publication that I want to highlight here, titled Menthol Ban, Highlighting the Facts and Rebutting Industry Misinformation. Yilon, already, mentioned this, the industry, puts out these arguments against menthol ban and flavor bans. And so this publication talks about some of the arguments the industry makes and how we can rebut some of those arguments. So I just have here our contact information. As I mentioned, please do not hesitate to reach out to us for any kind of assistance we can provide. So thank you for listening. And Yilon, I'm going to pass it back to you.
Thank you, Julie. I appreciate all of the information that you provided. So educational. Tristy, do we have any questions in the chat?
We do, and I'm actually going to allow individuals to unmute themselves if they wish to ask their questions to Yaneth. I know you have a question in the chat. Would you like to share that with Julie? Okay. Maybe my unmute feature is not working, but let me share Yanet's question. So she asked that if we included menthol as an additive in a local ban, would that open for the industry to fight it in court? Bringing up that the FDA has regulatory authority for characteristics of the products, since FDA has authority in the product standards. Does that make sense, Julie?
No, so when I talked about removing menthol, only the FDA can remove, can address anything to do with the product itself. So things like, the ingredients in the product, the additives in the products, so how the product, the product itself. So a locality can't ban menthol as an additive in the product. Only the FDA can do that. What localities can do is prohibit sales of products. So they can prohibit, sales of flavored tobacco products, and they can define, flavored tobacco products, in a comprehensive way that covers, that captures all of the types of products they would like to prohibit. So it's important to focus on sales because, and as we know, the industry is continually challenging flavor bans on the grounds that they are tobacco product standards. I mean, right now, the litigation that was filed, against Prop 31, right now is the argument that the industry has made and has been making is that even the flavor ban sales restrictions are product standards which only the FDA can regulate. So that has been the argument, and they've taken this argument to the Supreme Court. So we are still yet to know how the Supreme Court will come down on that. So, so jurisdictions want to be careful that they are not straying into the tobacco product standard category and that they are making it strictly a sales ban. And that is a tricky line. And I think the courts are still, the industry is still arguing that line is, that this is not, legal because it's preempted. And, states, so far, all of the cases that have argued that this is a product standard have failed. So localities and communities can rest assured that so far all of the courts that have entertained the industry's argument have said no, all of this are sales restrictions, but still localities should be careful. So this is a long way of answering your question to say, probably not, but they can ban the sale of flavored tobacco products. And one thing we are also seeing, is, in terms of the industry trying to circumvent the sale of these flavor bans is people coming up with flavor additives, various things that are not in the product but can be added to the product after the product. So all these flavor additives, menthol additives, Yilon mentioned the recent product that have come up, like Crush Oasis and all of that. So you see these attempts to circumvent flavor bans. And again, so the key thing here is making sure that the definitions in your policies, whether for tobacco product, flavored tobacco product, is comprehensive enough to anticipate what the industry will do to capture whatever products they bring into the market. I hope that somewhat answered your question.
Thank you. I got it. Thank you. Ernesta, go ahead.
I have just one question, Julie. You mentioned about educating the retailer. Since retailers are owners of the corner store, the liquor stores, and also have employees, how would you suggest, or what strategy would we use to approach that retailer? Because as a business owner, it's very uncomfortable to educate the employee because they are an employee versus the employer, which is the owner. So what would be some of the strategies for someone to educate a retailer?
Muted. Sorry, I was muted. One of the things communities have done is, they have information, and this is one of the benefits of a tobacco retailer licensing program, is that it gives the community knowledge of those who are selling tobacco products in that community. So when a law is about to be passed, retailers get a notice. So they know that a law is coming up, because the city informs them that there is this, and the city is required to give them notice. So so that is an opportunity for education. And after the law is passed, the city also notifies them and lets them know what is covered, what is not covered, what is prohibited, and so the retailers have sufficient notice of what of the law and what they are required to do or not do under the law. So that's one thing. And also communities, even in San Francisco, they use compliance checks as opportunities to educate retailers. So there's, they have periodic, some communities have one check a year or more than one check a year. And that is also an opportunity to educate tobacco retailers about the policy. And, something else in terms of like educating employees, one of the things that, some communities have done is to tie their licensing requirements. So in the licensing policy, they require the retailer to educate their clerks. So you see this like in T21 policies where the city or whatever would require as part of as part of the licensing program and even renewal, the employer has to show that they have educated their clerks around the minimum legal sales age and all of that. So the retailer themselves have an obligation to make sure that their employees are well informed of the laws.
And adding to that conversation, Julie, I just want to share a comment by Yanath. Having culturally tailored materials and in language materials are super important to educate retailers. And this is shared in our retail education environment study at USC. We learned that oftentimes retailers get information only in English, and sometimes that is not their first language. So knowing what languages your retailers speak to ensure that they have information in that language is imperative.
Yeah, thanks for that comment. That's a wonderful point to make.
Just got another question about conversations around hookah being included in a comprehensive policy while also being rooted in culture and tradition for some communities.
Yeah, Austin. So, I mean, one of the arguments, around hookah, some of the arguments that those make for exempting hookah, the main argument I think that is made is that there is some kind of cultural, traditional use, in the same way that, native communities have secret tobacco. And it's not clear, like I said, we have publications around this. It's not clear from what we've found that that is really the case, which is why, so that's the argument that is made, but hookah is, more young people are using hookah right now. Is now the social, so it's tied, socially. So it's not clear that there is a strong cultural, or traditional element in the same way you have with secret tobacco. And, the public health benefits of retaining hookah, I think are fairly strong.
Thank you, Aston, for that question. Any other questions? Anyone else that would like to raise their hand or unmute themselves and ask any final questions before we move on to the panelists? Okay, Yolanda, I think we're ready to move on to introducing our panelists.
Okay, I would just like to thank Julie once again. It seems like this is a timely and much needed topic of discussion. So Julie, I would be so appreciative to invite you back. Perhaps we continue this discussion further. This is something that is much needed within our CTCP colleagues. So I'm welcoming you back to have a further discussion with us in the future. And I do want to devote some time to our panelists. Thank you for being so patient, and to just actually touch upon this subject of purchase, use, and possession laws that we're talking about. And I do want to do justice to these wonderful people that I have on the panel. We have faith ministers and leaders with us, as well as California Tobacco Control Regional Grantee Projects, who are doing excellent work in our community, and community-based organizations that we've funded through our community engagement awards. Briefly, we'll be speaking with Dr. Kathy Jenkins of the Cynthia Perry Ray Foundation, Pastor Greg Hubbard of Branches of Zion Community Development Center, Ms. Ernesta Wright, Amplify Leadership Development Administrator and the Executive Director of the Green Foundation, and LJ Mariano, Program Manager for YLI Youth Leadership Institute. And the question I'd like to piggyback on, which is the subject of our discussion today, is the recent yes vote of Prop 31 will need to garner more community education to counteract the narrative that the tobacco industry has been perpetuating regarding criminal possession these past few years. Has the topic of equitable enforcement policies and policies that explicitly exclude civil and criminal penalties for use and possession in tobacco products come up in you as you are doing your work? And how have you addressed the topic?
Yolanda, I don't mind going first. Attending the menthol conference recently, there was a breakout session on this very matter. And what we came up with, a few of us in the committee or in the breakout session, was to educate law enforcement to make sure that they are fully aware of the law of the possession as well as purchases known as the PUP. So that was one of the areas that I felt that was needed to educate law enforcement. And how to do that, I would just suggest the same as we would do the retailers of drop off materials, as well as making appointments or meeting with law enforcement in those particular jurisdictions that we're all familiar with or that we are working in, to help support that effort to be more proactive, to make sure that they are informed would be one of my strategies.
Thanks, Ernesta. Does anyone else have experience or strategy?
You're talking about people in general, about communicating what it is you're trying to get across. Because what I do find, people don't read, and it's not really a put down, they really don't. So they miss a lot of information, they don't watch the news. But when you go with them one-on-one, even in smaller groups, you tend to get a little bit further with them than you do relying on newspaper articles or social media, because they don't really look at what's being said. But when you converse with them, it gives them an opportunity to even think it through. And why I'm saying that, because there was a lot of misinformation that was out there about the criminal part of the menthol, banning the menthol. And it was all the ones I talked to, they all had the wrong information. And I'm like, where are you getting this from? They were getting it from social media, they were getting it from friends, they were getting it from people that didn't know any better. So you have to tell them what really is going on. And then once you do that and you hip them to it, some people really like that, they're gonna tell somebody else. And then you tell somebody else, then you tell somebody else. And then that way they know. But if you're relying on other means to get the message across, I find that doesn't work. It's the personal touch and the trust. They trust what you're telling them is true. Those two things, I think, work more than anything.
Thank you for that strategy, Dr. Jenkins. It's wonderful. And I see that Pastor Greg Hubbard has his hands raised. Pastor Greg.
He's muted.
Amen. Can you hear me now?
Yes.
Great. Just to piggyback on both of those wonderful responses that we got from Ms. Onesta, and certainly the response we got from Dr. Jenkins. Two things is, one is not only do we need to educate our police, but we need to include having the relationship with our police so that they can understand the side that the community has with our police. Secondarily, we have to start putting our responses and our information on social media, because whether we know it or not, that is one of the main ways that people communicate now, is by the usage of social media. And then finally, we have to get it in our churches, because whether you know it or not, churches are still a place that people trust, usually the pastor. I will say that. So we've got to take time to get our message out about Prop 31, about what the police's, what I want to say, their prosecution tactics are, whatever it may be. I find that when we can play a simple couple of minute video and have a couple of minutes discussion about it, is really effective for allowing people to understand what's really going on. Because I agree, you know, a part of our community has a tough time with reading things, but we have to find other mediums to get it to them. All right, amen. That's it.
Thank you, Pastor Hubbard. I'm hearing this sentiment across the board, is that these smaller group sessions have been very effective. With the smaller congregations, the smaller groups is something that we need to strategize toward getting our messaging together with. Thank you. And LJ Mariano of Mint.
Yes, good afternoon, everyone. I echo everyone's sentiments about informing and educating the community, and also raise up what Brother Greg said about inclusion and not forgetting like folks in the church. Part of like our task is making sure that young people are always included in the conversation, because although we can garner the support of the community, if you're 18 and over, that's more power to you because you can vote. But for everyone under who is not old enough to vote, you are still impacted by the decisions of folks older than you. So in part of the smaller groups of educating, for us, it's been to create more meaningful opportunities for young people to engage, to feel, to process on how commercial tobacco has successfully targeted Black communities and other communities of color. We did this recently in the beginning of the school year, which propelled and like moved the young people to host a town hall. Shameful plug that for tomorrow in Fresno if you all want to come through. But they were moved by the stories and everyone sharing how they've been impacted by the tobacco industry after they watched the Black Lives, Black Lungs documentary. But it was because we held a meaningful space for them to process, to talk about how this impacts them, how it impacts those that are close to them. And then in addition to what was also already being said is educating and including the retailers a part of the change. And so we're still working that one out, trying to figure out what our approach is, but we want to make sure that we can build a bridge with our retailers because they're trying to pay bills. They're certainly not wanting to harm anybody. That's more of the industry. So if we can find a way to build bridges with our retailers, I think that's something that we can build towards.
Thank you, panelists. I appreciate these practical strategies. I've taken notes and I'm going to make sure that this is shared out within our CTCP projects. This is a great discussion starter of how we can counteract these narratives. And I would love to spend more time with more questions, but we are running out of time. I do want to briefly open it up for questions from our audience, if there are any. Tristy?
I don't have any questions as of yet. I did want to share a couple of resources. One, the Center for Black Health Equity is shared an invitation to join a meeting that's occurring in Oakland, California on December 1st. So there is a registration link along with a code. Please use the code to register for the event. So that has been shared in the chat. And then for anybody who wants to leave their contact information so that folks can reach out to you. And I feel like Yolanda and I might be hosting another meeting to talk a little bit more on this topic.
Okay, we truly appreciate you spending this lunch hour with us. It was so informative, and we just look forward to having more of these valuable discussions with you. Please take a moment to fill out our survey and let us know how we did, how we can improve, what other type of topics and subjects you would like to see us cover. And on behalf of all of us, Julie, Shristi, myself, the panelists, we thank you and have a happy holiday season. Thank you.
Thank you, everyone.
Everyone.